If you choose to seek help from your medical doctor for your pain, there's one last treatment he may prescribe. It's not a drug in the sense that it's a pill, but it is a medication. And it's especially popular for low back pain and leg pain known as sciatica. It's one of the most frightening medical treatments of all. Welcome to the world of epidural steroid injections. This is a common choice for treatment of back pain by a lot of medical doctors. Here's how it works in a nutshell. In an attempt to reduce back or leg pain and inflammation, pain doctors use an X-ray guided injection of steroids directly into your spine. Does that sound fun? Does it sound dangerous? Well, the PDR, the guidebook doctors are supposed to follow when prescribing medications, specifically states, quote, suitable sites for intra-articular injection are the knee, ankle, wrist, elbow, shoulder, phalangeal, and hip joints. Joints not suitable for injection are those that are anatomically inaccessible, such as the spinal joints. Again, joints not suitable for injection include spinal joints. If you're bold enough to ask your doctor whether or not the PDR approves of the large needle he wants to stick in your spine to help your back or leg pain, don't expect a straight answer. If your doctor admits anything at all, he'll probably say the PDR is just being overly cautious and he's injected hundreds of spines without any complaints. Ask him why it is then that epidural steroid injections have been banned in several countries around the world. You don't have to be a brain surgeon to realize injecting a syringe directly into your spine is not a safe or natural way to relieve back pain. An epidural injection delivers steroids directly into the very thin epidural space in the spine via a very long needle. And according to studies, blind needle injections, even by skilled and experienced professionals, has been found to be inaccurate 25 to 30% of cases. That means if a pain doctor wants to give you just a single epidural injection to help with your injury or pain just to see if it works, you have a 1 in 4 chance of becoming victim of an inaccurate injection. And that's if he's a skilled and experienced professional. So, what's the big deal about haphazard inaccurate injections to your spine? Well, just ask Dennis Capolongo. A nagging hip pain prompted Dennis to visit his doctor. After receiving just 2 epidural injections, he suffered 2 trips to the hospital, was hospitalized, and suffered non-stop back pain. That's not even the real tragedy. Dennis developed arachnoiditis, a pain disorder caused by the inflammation of the arachnoid. That's one of the membranes that can be easily damaged as a result of blind epidural injections. He can no longer work or do anything he used to because of his condition. He describes the condition as, quote, sheer, hopeless hell. And there is no cure. Dennis invests the little strength he has to warn unknowing patients like yourself of the horrific dangers of epidural injections. Does this form of treatment sound like something you should gamble on? I would think not. Now, let's just recap everything you've learned so far about the only drugs your doctor can prescribe to help you recover from your accident or injury. Over-the-counter painkillers, which have been proven to erode the stomach, cause ulcers, and turn your liver toxic. Prescription painkillers, which will also inevitably lead to dependence and addiction. Muscle relaxants, which will mask your pain while you do even greater damage to your body. And finally, the epidural spinal injections, which can leave you terminally sick, paralyzed, or worse. I hope you see that none of these are a wise choice to eliminate your pain and recover from your injury. Now, with drugs out of the question, there is one more form of treatment your doctor may recommend for you to relieve your pain and recover from your injury: surgery. Now, before you jump at the chance to go under the knife, remember that there are almost 250,000 deaths each year in the United States alone due to the adverse effects of surgery and drug treatment. Certainly surgery is the right choice for certain conditions, like repairing a broken bone for instance, but that still means you have to recover afterwards. What is most alarming are the shocking statistics that not only are many surgeries ineffective and actually cause more damage, but many are unnecessary. According to PhD and renowned author Gary Null, it's estimated that 7.5 million unnecessary medical and surgical procedures are performed each year. Instead of fixing or healing your injury, these unnecessary procedures can lead to greater health problems and even death. In 1995, a report by Millman and Robertson Incorporated concluded that nearly 60% of all surgeries are medically unnecessary. So, in the hope of getting rid of your nagging injury so you can be pain-free and your body can get back to normal, surgery can easily mean paying a ton of money for an unnecessary procedure that results in permanent damage to your body. Anyone who has ever undergone surgery will tell you, once you go under the knife, you will never feel the same. The body will never be the way it was again.